my name's Tabitha Cherry. I'm going to be the nurse today doing your assessment. What is your name?
Alexa.
What's today's date?
July 22nd, 2015.
Awesome. Who's president?
Obama.
Awesome. Well, if you don't mind, we'll get started. Let me wash my hands first and we'll get your physical assessment going, okay? I'm just going to wash my hands. Get started. So first we're going to do some vital signs. Take your blood pressure, temperature, O2 sat, listen to your heart and everything. Pause it.
Go.
Okay, so we're going to get your vital signs real quick. I'll wash my hands and we'll get started. First, I'm going to take your temperature. This is a temporal scanner, which will measure your temperature. Perfect. Next, we're going to do your blood pressure. Have you ever had your blood pressure taken before?
Yes, ma'am.
Awesome. So this just goes on your arm. This is my stethoscope. And we'll just listen. Put your arm out like this. Just let it relax. Put your arm out for me. Awesome. We're just going to pump it up to about 150, 160. You have a great blood pressure, 117/71. That's good. Let me just write it down. I'm going to put this on your finger. I don't have a pulse ox machine, so this is my prop for a pulse ox. And I'm going to listen to your heart and check your pulse at the same time, okay? Pulse is 80, O2 sat is going to be 98%. That's all normal. Everything looks good so far. How much do you weigh?
135.
Okay. Next, I'm going to look at your hair. Just your scalp, check for any abnormalities, anything like that. I'm just going to feel, okay? No contusions, lesions, nice and soft. Everything's normal there. I'm going to feel of your sinuses and your maxillary sinuses and your frontal sinuses. Does this hurt? Can I press down? Does this hurt in here? Okay, I'm going to check your mandibular. Open up your jaw. Close it. Any pain or anything there? None? Do it again. Awesome. Okay. I'm going to check your capillary refill on your nail beds. So, everything. Those look good. Skin looks good. Normal turgor. Everything's good there. No lesions, anything like that. Okay. we're going to get started with your eyes. I'll do your eyes and ears and nose and mouth. And this is a pen light that I'm going to use. So for video purposes, I won't turn the light off, but we're going to check your pupils out. So just look. Normal, great. I'm checking the reflex. Now I'm going to have you to, with your eyes only, follow this, starting here, okay? And so we're going to go here, here, eyes only, here, eyes only, here, here, okay? So those were checking your cranial nerves. Now I want you to touch my finger and then touch your nose, okay? So touch my finger, touch your nose, touch my finger, touch my finger, touch your nose. Now here, touch my finger, touch your nose. Looking at me, touch my finger, touch your nose, touch my finger, touch your nose. Touch my finger, touch your nose, okay?
Go.
Okay, we're going to check for the red reflex, so I want you to look off into the distance. And then look at here at the camera. Check your conjunctiva. Make sure they're not yellow or any lesions, no drainage. Everything looks good there. So I don't have a Snellen chart, so I'm going to use a prop that I've got off camera. So I want you to tell me the lowest line that you can read. Read the letters for me.
P-A-I-N-T-E-D B-L-I-N-D.
Great, that's 20/20 vision. It looks like your vision's okay. That's awesome. Okay, next I'm going to use an otoscope to look in your ears. Right here. The external looks good, no lesions. Inside, tympanic membrane, pearly gray, that's normal. Let me go on this side. Outside, looks good. Inside, tympanic membrane, pearly gray, that's normal. Now I'm going to do a voice test, so I want you to, I'm going to turn away and I'm going to whisper something and I want you to tell it back to me, okay? To see if you can hear, okay? I'm going to say
Red.
awesome. Let's do this side.
Blue.
Awesome. You don't have any tenderness or anything in your ears? Great. Now, if I don't have a tuning fork that we would use, but if I did and I would tap it right here on the mastoid process, you would feel that. And the same thing on this side. If I tapped it on the mastoid process, you would feel that. Okay, so on with the tuning fork, if I hit the mastoid process, you would feel it, of course, but you would also hear it. on both sides. Understand? Okay. Okay. I'm gonna look at your nose. No, it doesn't look like you have any. Your nose has never been broke. Okay. Over here, I'm gonna look up in your nose. My little light. No redness, edema, or any lesions. That looks good. Ready? Okay, so next we're going to look at your mouth. I'm just going to look inside and check your gag reflex and look at your uvula. Outside looks good. Can you open up? I'm just going to use the tongue blade here. Can you open up and say, ah? Ah. I'm going to look in here with the light. Okay, this is my light. Open up and say, ah? Ah. Beautiful. Looks good. I'm going to check your gag reflex. Say, ah? Ah. No lesions. Hard palate looks good. Everything looks normal. Open up and say ah again. Ah. See, you don't have any tonsils. You had those removed. Okay. Okay, I'm going to check your uvula and your cranial nerve. So I want you to say ah again. Open up and say ah. Ah. Okay. Okay. I'm going to check another cranial nerve. Can you stick your tongue out? Move it up and down, side to side. Awesome. Okay. I'm going to check your neck and your lymph nodes. Do you have any swollen lymph nodes that you've noticed? Can you turn your neck side to side? Put it up and down. No pain. Okay. Just gonna feel here. Checking your lymph nodes. Okay. I'm going to check your carotid pulses. I'll check them on this side. Good. Check here. Good. Now I'm going to listen to see if I hear a groove, which is a swish swishing sound. I'm going to listen on the carotids, okay? Did not hear anything. That's good. No swishing. Okay. I've got this glass of water that I'm going to have you to drink, and I'm going to have you to look like this and swallow, and I'm going to check your thyroid gland. Okay? Okay, so just take a drink, and then I'll tell you to swallow. Go ahead and swallow. There. Trachea, thyroid. Okay. And then I'm going to get behind you here, and I'm going to check here. Okay. Okay. I'm just going to listen to your lungs and on the anterior chest and then the posterior chest. Listen. Take a big breath. Okay, this next thing that I'm going to do is it's going to test for the normal vibration sensation. And I'm going to do where I'll listen to you at. Okay? And so when I do this, I want you to say 99 when I feel it. Okay?
99. 99. 99.
Okay. Any tenderness here? Here?
Nope.
Here?
Nope.
Okay. I'm going to listen to your heart. Just breathe. I'm going to check your upper range of motion, starting with your hands. So can you do what I do? Can you put them out here? Yep. Up. Sideways. Down. Put your hands up. Put your feet here. Sideways. Yep. No problems? Okay. I'm going to have you to lay down now, if you don't mind. Lay all the way down. We're going to listen to your bowel sounds. Symmetry looks good, no lesions. So for video purposes, I won't listen for 5 minutes. I'll listen till I hear vowel sounds. I'm going to do the right lower quadrant, left lower quadrant, left upper quadrant, right upper quadrant. Should be able to palpate the liver. Any pain? On the left side is the spleen. Normally you are able to palpate it, but it's normal to be able to palpate the liver. So I'm just going to do this in right percussion, where I'll listen to the vowel sounds out. No pain? Okay. I'm going to check for femoral pulses, just right here. To sit back up. And I'm going to check the reflexes with this reflex hammer here. Okay? So first I'm going to just check your reflexes in your arm. The brachial. Check your reflexes here with the reflex hammer. Okay. Here. try this again. Check your reflexes with my reflex hammer. Okay. Now I'm going to get down here and check your reflexes here. The Achilles reflex. My reflex hammer. Okay, that's good. Now, this is, go ahead and lay back for me. And I'm going to check your pulses. Okay. Checking your pulses. Occipital. And your pedal pulses. Okay. Can you look at your toes? Skin looks good. Lower legs. We're going to try the range of motion. So I want you to lift your leg up. Okay. We're going to check your range of motion. So lift your leg up for me. Down, up again, cross it over to that one, put it back to this way, put it down, let's do the other one, lift it up, lift it down, put it over to this way, put it over that way, put it down. Okay, I'm going to have you to sit back up, and I'm going to check your sensation, where I will have you to distinguish between sharp and dull. Okay? Let's try this again. I'm not going to give you a shot. We're just going to distinguish between sharp and dull. It's just going to feel. We're just checking your sensations. Okay? Okay. Sharp or dull?
Dull. Sharp.
Okay.
Sharp. Dull.
Okay.
Dull. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull. Sharp.
Okay. Okay, I'm going to have you to lay back. And I'm going to check the Babinski reflex on your foot. Good. Okay. Okay, I'm going to have you sit back up. I need to go back and check the cranial nerve, and so I want you to close your eyes and smile. Puff out your cheeks. Blow them out like a big blowfish. Okay, everything's good there. Now I want you to okay, I'm going to see how you do walking. So you'll stand over there and just walk towards me. Okay, go back. Okay, walk on tiptoes. Walk to me on tiptoes. Okay, go back. Now walk on your heels. Go back. Okay, everything looks good. I want you to stay standing there, and I'm going to check your balance. Okay, so close your eyes. Hold your hands out. Put them onto your side. Put them back up. Put them onto your side like this. All the way out straight like you're flying an airplane. Do it again like this. Okay, good. Okay, Bend down and touch your toes. You can open your eyes. Bend down and touch your toes. We're going to look at the curvature of your spine. Everything looks good. Doesn't look like any scoliosis. Good alignment. Okay. You can have a seat. Okay, I think that concludes my assessment. Thank you for letting me do the physical assessment on you. Have a good day.